We're joined by Rick Weiland, co-founder of Dakotans for Health, the organization behind the push to get a constitutional amendment on the 2024 ballot to legalize abortion in South Dakota. Rick, thank you for joining us. We appreciate it. Give us a quick rundown and breakdown of what exactly this amendment is.
Well, it's an amendment to the state constitution that would essentially codify Roe v. Wade, which has been a 50-year law precedent that was overturned by the Supreme Court earlier this year. So we're hoping that we can collect enough signatures through a citizen initiative effort to get it on the ballot in 2024.
And the Attorney General's office released a description of what exactly this is in their opinion. So I guess from your perspective, did they do it justice? Is it fair how they laid it out on that?
No. Yeah, absolutely fair. I mean, there's a process you have to go through when you do these citizen initiatives, and I'd remind your viewers that South Dakota was the first state in the country to allow citizens to basically pass public policy and amend their constitution at the ballot box. But you got to go out and collect a lot of signatures to do that. And I think Attorney General Vargas did an excellent job. Basically, he's required to provide the voters an explanation of what our amendment would do.
And we'll talk more about the signatures in just a little bit here, but I do want to kind of just clarify one thing for the viewers. I think that the first trimester and the third trimester explanations are pretty straightforward. Where I think there could be some confusion potentially is in that second trimester explanation, where you talk about a reasonable health impact to the pregnant woman. Can you talk a little bit more about that, and maybe what an example of that, or what does that exactly mean?
You know, that's a great question, because I think you know, there's always been a certain amount of vagueness, even with Roe v. Wade, what that would allow, and the way that this has been written, you know, the state can engage as long as it's to the benefit of the health of the mother. For example, I mean, they could regulate abortion that a doctor needs to, you know, perform it, which is always the case, or where it could be performed. So they would have the flexibility to engage, but very limited, and only when it involves the physical health of the mother.
Okay, that makes sense. Talk about this a little bit. This is a constitutional amendment you mentioned. Why is this something that it's important to leave up to the people, the residents of South Dakota, to vote on, rather than leaving this all to state lawmakers?
That's a great question too. I think we've seen here in South Dakota where the legislature many times is out of step with the will of the voters. We were involved early on in trying to increase the minimum wage back in 2014, and the voters approved a $1.25 bump with a COLA, and first thing the legislature did when they came back for session was to try to amend that to exclude young adults from getting that wage, and that was referred by the voters and passed overwhelmingly. And I think there have been efforts. We did an initiated measure on corruption and campaign finance reform. That too was passed by the voters. Unfortunately, the legislature figured out a way by declaring a state of emergency. They could repeal it and we couldn't refer it. But just more recently, you know, what's happened in the cannabis world, you know, between medical cannabis being passed and recreational cannabis being passed. We're still waiting on recreational, but you know, there was an effort to challenge the constitutionality of the recreational amendment, and it was successful based on a single subject concern. You know, so the other thing I guess I'd have to point out is sometimes, you know, the legislature, I mean, we've got you know, maybe 11 Democrats, I believe, out of 105. That's not necessarily representative of the entire state. I know the Democrats are a minority party, but you know, the whole process of redistricting and drawing maps, I think, has been done in a way where it isn't really representative of the voters and the percentages of the parties, the people that they have that are registered as Democrats versus Republicans. So, you know, the Alito decision basically turned it back to the states to decide. And we strongly feel, and I've got friends on both sides of this issue, we really strongly feel that this is one that definitely the citizens of South Dakota need to decide on their own and let majority rule. It's the country and the state that we're living in. This is a personal decision for many people. We want to put it on the people. We're saying let the people, we want to put it on the ballot. We're saying let the people decide this one, and that's what we're doing. That's what we're going to do.
Mm-hmm. And so let's clarify another thing for the viewers here. This is something that will be potentially on the 2024 ballot. We know we have an upcoming election in November, but this isn't something those voters would see on the ballot in November. This is something you're working on for a couple years down the line. What is the next step? What's that process look like for you?
Well, again, another great question, Scott. This will be on the 2024 ballot, okay? It can't be on the 2022 ballot. That's less than a few months away. We just got the explanation from the Attorney General's office. The next step for us is to turn around now and submit our petition form to the Secretary of State's office, and our requirement by the state circulator cards, circulator handouts that are required by the state for anybody that's circulating the petition. So that's a process. We also need, in some cases, not in this one in particular, there's always a requirement for a fiscal note, but that's a whole nother process for other measures that may end up costing the state money to implement. So we're going to submit, and already have this week, I believe, to the Secretary of State, our petition form and circulator handouts. And by law, we can't really even begin to collect signatures until November 5th. We'll have 365 days as of November 5th to be able to collect what we hope will be well over 60,000 signatures to turn in, which will then have to go through a validation process by the Secretary of State. And the magic number will be based on 10% of the total votes cast in this upcoming gubernatorial election. That's just the way it works.
Yep.
And so we'll be hitting the streets on November 5th. And as a matter of fact, we have a big event coming up on the 10th of September to update our people. We're going to have voter registration tables, merch tables, live bands, live music, some speeches, some guest speakers, and we're really excited. We've got right now, I think, almost 300 people that have signed up to help with this campaign to put Roe on the ballot.
And Rick, if folks want to find out more about that event or where they can find out more information about this amendment in general, where can they go? Where can they find some other information?
Well, we've got an event page on Facebook. They can always go to our website, DakotansforHealth.com, and it's Dakotans4, the number 4, health.com. We're asking people to register. Yeah, it's all over the internet. We're really excited. We got a great reggae band lined up, Tough Roots. There'll be lots of vendors there, organizations who are supporting the effort. We'll have information, and we're expecting a really good turnout.
Rick, anything I didn't ask you about that you want to make sure you tell the people?
No, I just appreciate the opportunity. This is a tough issue for a lot of people, and we feel good about what we're trying to accomplish here. We feel even better about letting the voters make this decision and not the legislature.
Rick, thank you so much for coming in and breaking everything down for us and talking about a topic, like you said, that is such a big thing and has a lot of impact on many, many people.
Yeah, thank you, Scott.
Appreciate it.